Hi, I'm Dr. Satish Kumar and this is Kaizen Dental. Our aim here is to help dentists succeed. In today's Kaizen Dental Success Stories podcast, we are going to talk about dental photography with Dr. Mayur Davda. Dr. Mayur Davda is an astute clinician, passionate photographer, tech geek, blogger, podcaster, a national and international speaker for dental medical photography. He is an alumnus of Dr. D.Y. Patil University School of Dentistry, Mumbai. He speaks across the globe on dental photography. He is the resource person for dental photography for fellowship in aesthetic dentistry in Dr. D.Y. Patil University School of Dentistry. He is also the course mentor for a 3-month certificate course on dental photography conducted by Manipal College of Dental Sciences. He started the dental photography school long before dental photography was in vogue. He also has a podcast named 32 Minute Podcast. Welcome, sir. It has taken me a month to convince you to come on our podcast, first of all. So I'm thanking you for your time.
Journey
Uh,
never stops.
Coming to my first question. Uh,
Yep.
Usually, when you get into a new field, you look at the people who have achieved something, you get inspired by them, and then you start. When you started with dental photography, I really had not heard any names at that point of time. No one was doing it. It was not the in thing. Like everyone wants a DSLR now, wants to get into it now. What inspired you? Like, how was your journey? How did it begin?
Uh, okay, let me begin with I was a very shabby student. I was a very dumb student in dentistry. But when it comes to work and work ethics, I really like to work very clean and I really try to follow what are the, you know, uh, what do we call it? The protocols,
Protocols.
probably, to the T. So because of that, I have lagged a lot in college. But then I personally believe that when you do something as per a protocol, it's going to give you a better result. And that reflects very much in our patients in dentistry. If you are following protocols like rubber dam, isolation, obviously that filling is going to be lasting longer, that bonding is going to be lasting longer. So I was really basically keen to improve my work, and that's when dental photography came into the picture because I was not a very keen fan of mobile phones, also mobile phone photography, which was also kind of beginning only at that time. But I was very sure that I can improve my work with the help of a DSLR. So when I actually started off, I had no macro lens, no flash, nothing, but a DSLR, a decent DSLR I started off with. And the basic point of buying that particular DSLR was to see the mistakes clearly, and once we start seeing the mistakes clearly, there's a lot of regret that happens at night when you finish your work after every day, and then you keep on thinking about improving your work. So that is the reason why I bought a DSLR for self analysis. And then pretty much I realized that this is really boring and you cannot just keep on doing self analysis. So that's the reason why I took the camera outside for butterflies photography, wildlife photography, and then I improved my photography skills. But the bottom line of uh, getting a camera was to improve my work, which I was really keen on because I'm a firm believer that when some patient is coming to us, you have to live more than their expectations, because their expectations are probably indifferent. They don't know dentistry. But since we have learned dentistry, we should be able to look at ourselves in the mirror in our eyes when we think about that particular case, and then the only way to actually achieve that is keep on improving your work. Unfortunately, that never stops in dentistry. You're constantly learning something every day, and the concepts just suddenly change over a period of time. I was like, what the hell, this was right up till yesterday and today it's no more right. Today there's something else that's completely right, which was completely opposite of what you thought yesterday. Yeah, so the basic point of getting into dental photography was self-analysis, and that's why I got a DSLR, and it worked pretty well. I can proudly say that I do decent work. I'm not
Good work.
an
I've seen it.
expert like a pro level posterior filling guy or an anterior filling guy. But like right now, I just finished a case and I came for the interview, and the patient really thanked me that I had probably exceeded his expectations, although the work wasn't that aesthetic. But I'm very happy that the patient is very happy, and I did really the best that I could in terms of my work ethics, in terms of work culture, isolation, the protocols like removing the GP. There are so many protocols for every field.
Yes.
Even when we do something a little bit haywire, I don't feel comfortable with it. I really like to stick to the protocols, try to give my patient the best that they're paying me for.
So, other than self analysis, what are the other advantages of basically getting into dental photography? You might have seen more of them as you got
Oh,
into it.
so yeah. There are a lot of uses, I can say. Advantages, yes, it becomes over a period of time, but there are a lot of uses of dental photography, and it depends upon you whether it becomes an advantage for you or not, right? So the use of dental photography, like we all know, the basic use is most of the people think it's only for lab communication, which is probably just 1% of what dental photography is. Um, for me, dental photography is more about educating the patient, because let's be honest, like you and me both are clinicians. How many of your patients know what is a composite filling, what is a emax restoration? You tell me. Do
Of
they really
course.
know? They just know that somebody in their family has done a tooth colored filling. They don't even know.
Yes.
In fact, my patients tell me, I want a ceramic filling. I was like, brother, there's nothing like a ceramic filling. There is a
It's a common
composite
question.
filling. And yeah. And I'm very sure. Haven't you heard that? Give me a
Yes.
ceramic filling. Tell me the truth.
Yes,
So
everyone
the
else it.
bottom so the bottom line remains that we need to educate our patients. All right. So how do we do that? Obviously, we are not going to be asking them to read and count. We are going to show them things. And if you want to show them quality work, you need to have quality pictures. And the best way of convincing them for a treatment, and the best way to educate them that what is the right treatment for them, is not a verbal technique. It's for me, it's a pictorial technique wherein I actually show them, boss, this is called as a rubber dam, and this is why I probably charge a little bit more than the adjacent dentist, because I'm really keen on using the rubber dam. Even if you don't want it, I'm going to use it because it's not only for your safety, especially now in the pandemic situation, is very safe for me as well. Then they understand why am I charging a little bit more than the adjacent dentist, because I've been using a rubber dam since a very long time. And I'm very comfortable with it as compared to a beginner who might probably take a little bit longer, who might struggle a bit to put a rubber dam. For me, it's like a piece of cake, and I do everything under a rubber dam. I wish I could do extractions under a rubber dam. That's how keen I am when it comes to using a rubber dam. So for me, dental photography is a huge tool to educate my patient as to why I'm charging so much, whatever I'm quoting them, because my work is different. I like to live up to my work, my expectations more than the patient's expectations. We need to upgrade ourselves. We need to upgrade our patient's knowledge as well. So educating the patients for me is really important, and that's how I exploit dental photography mainly in my clinic. But like I said, dental photography has a lot of uses, and if you excel in one particular use, that becomes an advantage. For example, for me, educating the patient is becoming an advantage because now they're getting converted into the kind of treatment that I would probably want to give them and not what they want from me. For example, I've converted a lot of my patients who want a PFM crown to an inlay or an onlay kind of prosthesis, because that's much more conservative, and they also understand when they see the pictures. So what are the other uses of dental photography? It could be forensic odontology, it could be for marketing purposes. You can use your pictures on your website, of course, on your Facebook or Instagram. You can make videos, you can post those videos. For publications, of course, it's important. And when you are putting your pictures on Facebook, it also becomes like an educational thing, because people are going to be commenting on it, whether good or bad, how you could have been better. So it's a great tool for education. For tutors, of course, they can use pictures of their cases or somebody else's cases and teach the students on a webinar, or even in colleges. So basically, yes, like medical, legal, insurance, there are more than 50 applications of photography in dentistry, and whatever you do repeatedly and keenly enough, it becomes an advantage for us.
So there are so many uses, but why do you see most of the dentists not using it? Why is it lacking in our country when we know there are so many
Uh,
advantages of doing it?
I disagree. In fact, I think a lot of people are doing it, but it's just that they are doing it with the wrong tool. Let me give you an example. Even if a first year BDS student is taking a picture of their typhoid, that is still dental photography, right? So it's just that
Okay.
they are doing it, but they don't know, they don't know that they are doing it, and it could be helpful for them. Probably they are not aware that how they can exploit the real power of dental photography. But yes, everybody's doing it. If you want to exploit dental photography, you have to do it in a particular way so that it becomes comparable to something that you're planning to do in the future. For example, if I'm doing a case today and if there's a similar case after 3 years, I'll probably go back to my 3 years work and see how I've done, and probably try to live up to that expectation or do something better. The problem is people are doing it but not really using dental photography, and the tool that they are probably using is not that great. But yes, I would probably want to conclude that the awareness about dental photography is still a little less, although it's way better than when I started off in 2013, when I actually had to go door to door to every dentist and say, please do dental photography because it's a very good tool, not only for your finances, marketing, but also as a self improvement thing. So the condition today is way better. People know what dental photography is. There's a trending hashtag on Instagram that's hashtag dental photography, and a lot of people follow it. But it's just that we need to start using it more and more. Maybe people should start trusting dental photography as something that they can rely on, if that's going to be helping them to become a better dentist or a better dental student.
So when you started, what difficulties you faced? As in, what did
Oh,
you and how did you
as
overcome
as
them?
as 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 a person who is doing dental photography, or is this question
When you started
for
teaching, for when you started teaching dental
teaching?
photography
Okay.
school,
Uh, okay. When I started Dell Photography School, okay. So right now, my main thing about propagating about Dell Photography is no more to encourage. So when I started in 2013, I had to actually give free lectures to dentists saying that dental photography is important. Please do dental photography. And now I don't have to do that anymore. Probably in three tier cities, I might probably want to do that, but not anymore. So right now, I just have to encourage the students. That's completely fine because dental photography is not a part of our
the curriculum.
official curriculum. That is something regrettable, but that phase of actually telling clinicians that please pursue dental photography is not there anymore, because I've really given it more than 7 years of my life. So I'm pretty happy about that right now. Yeah, but those were very difficult times wherein I had to actually spend money from my pocket
To
to
teach
tell
them.
somebody that, yeah, please do dental photography. That is a different change. So I, yes, when you're asking me how I started off, it was like this. I used to so there was no podcast at that time. There was only Facebook. There was no Instagram. So I used to post on Facebook that this is called dental photography and these are the uses. It can be done with basic equipment. Please do dental photography, and this is how it's going to be helping you. So this was one way on Facebook. Another one was booking a hall probably somewhere with my money and just
You had done
giving a
one in
lecture.
Ghatkopar or Chembur somewhere, right?
Many places, many places, and at that time I had no recognition, no name. So why would anybody want to entertain me or probably do partnerships with me? Because first of all, they thought it's a stupid idea. I know some of the best dentists today who have put me down as in saying that, okay, I don't think this is a great idea because it's going to be a non-profitable cause for them. So yes, I have had my hard times, and I would probably not want to take the names of those people out here, but I've been put down by a lot of people, and but it's just out of passion that that fire in me to teach dental photography survived somehow. Although there were ups and downs for sure, there have been a couple of months wherein dental photography school was completely stagnant. In fact, I had given up thinking that okay, I've done too much of encouraging the dentist, and that's not my job. If they want to do it,
We'll
they'll
do
do
it.
it. But I'm really tired of actually telling them please do dental photography. I'm sorry to say that, but it's a fact.
Understood.
Because at one point of time in your life, you actually have to think you're not earning money, you're spending money from your pocket, and what's the bottom line of this? They don't even want to learn. So fortunately, that phase has gone now, and people now want to do dental photography much more seriously than they would probably have thought of in 2013. So yes, difficult start. Probably gave up dental photography in between, and then reignited somehow. And then when it reignited, I remember a lot of speakers who were the best in their fields. They started coming, and when those big names start coming and they start learning from you, they do spread a word about me. So that was a plus point. Like today's best known dentists, they might have done dental photography coaching with me, and probably they were the key in spreading more awareness than me alone, that please do dental photography. Because if you're planning to do implants, if you're planning to do aesthetic dentistry, boss, the only way in which you can convince your patient or even other dentists to do your course is by the way of photographs. So that was the best thing for me that ever happened. So the best known dentists, they did courses from me, and fortunately for me, they spread a good name for me, and that's how I stand today, and most of the people know me as somebody who's teaching dental photography.
So now, if someone looks at you, looks at your work, gets inspired, and they want to start dental photography, what are the basic requirements they need, and how much it would investment they would have to put, and how do they start?
Okay, that's a great question. I probably want to divide this into two parts, for a dental student and a clinician. If you're a dental student, very honestly, don't think too much. Just start away with your phones. Now, most of the phones have a great camera with a good resolution. So even if you have a phone, start doing dental photography. Because ultimately, you are in a college, and it's fine. Okay, because you don't have to convince your patients. You have a particular quota to finish, and that's completely fine if you use a phone. The moment you go into post graduation, start thinking about getting a camera, because now you're getting serious about your field and you're getting good cases that you might have not gone as an intern. All right. So this is one thing that I probably want to say. If you're just a graduate student, just use your, if you're just a graduate student, just use your phone. It's completely fine. But the moment you go into post graduation, think about getting a DSLR for yourself. One second, I'll just remove my WhatsApp. Yeah.
No problem. Yes.
So yeah, so this is about the students. Start with whatever you want, whichever phone you want, and now with the clinicians. So clinicians have a mouth to feed, right? You have to get some economics out of whatever you're doing, and it looks very unprofessional if a clinician is using a phone to document a particular case, because the patient might not really think great about you if you're using your phone, and that's the same phone that you're going to be using for communication purposes. So that is something like a standard. Please respect the dignity about yourself, and please buy a camera, because using a phone in front of the patient is not really going to look great. But that's not the only reason. There are very good things that you can do with a DSLR. For example, you can maintain good as asepsis. You can take great pictures, good macro close-up photography. You can educate your patients nicely. And the best part of today's cameras is, as soon as you take a picture, it's seen on a smart TV or an Android device or an iPhone or an iPad. So as soon as you take a picture, because most of the people think it takes time for them to show the pictures. So that's not true anymore. If you take a picture on today's camera, it has Wi-Fi and directly goes to your smart TV. And it looks very professional. As soon as you've taken a picture on your DSLR, damn, it's seen on the TV, and the patient's like, "Wow, this dentist is really good," because he does not mind showing what he's done in your mouth, right? So this building transparency and confidence for your patients onto you. So please get a good, reasonable DSLR, even if it's a second-hand DSLR, is completely fine. For me, actually, macro lenses are the key. So if somebody wants to understand how to go about doing great dental photography, please understand that the camera is the least important thing in your equipment. So don't invest too much on the camera. Invest minimum on the camera, invest a good amount on the lens, and invest maximum on the lens. This is something that I propagate a lot, and it's called as the reverse concept by Dr. Mayur Davda. If you heard of Dr. Mayur Davda. And the concept
And
says that
attended
you
it.
need to invest a lot on you need to do good dental photography, then you need to invest maximum on the flash, medium on the lens, and minimum on the camera. But unfortunately, a lot of students and a lot of clinicians, the first question that they ask is कौन सा camera लो? अरे भैया, camera is the least important thing, invest minimum on it. And a lot of PG students actually buy a very expensive camera. That's what I have seen, because I go to a lot of colleges and they've bought the most expensive camera, and now they're like, I don't have money to buy the right lens, which is the wrong way of going about things. So this is one good suggestion for everybody out there. If you want to exactly know the model names, the model numbers, probably you can check out my podcast or my YouTube channel, wherein I've explained a lot in detail about all these things. And there are separate episodes. For example, best
We'll be
camera,
putting the
best.
YouTube channel on our Instagram page, so do not forget to
Yeah,
go and check it out.
please do that. And yeah, and coming to the most important equipment now, irrespective if you are a student or a clinician, you need to have great intraoral accessories. That's the key for good documentation. And if you really honestly ask me, where people go wrong in poor documentation is not because of their equipment, is because their retraction is bad and how they hold the mirror or the contraster is bad. If you excel in doing good retraction, which requires you to have different sets of cheek retractors, you need to have different shapes of cheek retractors. For example, you need to have something called as a quadrant cheek retractor or a sectional cheek retractor. You need to have something called as a C shape, something called as a V shape. So different uses of different cheek retractors is the key. And after doing cheek retraction, you need to have good isolation, you need to have a good suction, obviously. But even the way people place the mirror, people buy wrong mirrors. That is also one fault. So if you want to buy good mirrors, please go for front surface coated mirrors. I'm sure everybody must have heard of this. There's something called as behind surface coated and front surface coated. So go for front surface coated mirrors, or just go for full stainless steel mirrors. Even these particular points, I have elaborated a lot on my podcast. So check it out over there. But I personally believe that good dental photography is definitely possible if you have a great set of intraoral accessories. And trust me, I'm not trying to propagate my brand over here, but Magic Box, that's the full intraoral accessory kit, is probably the best thing that I actually invented. And after using my own Magic Box, I haven't had to look anywhere else to buy different things from different places. And that's one thing that I would suggest that everybody should have, irrespective if you are a dental student or a clinician.
This leads me to your next question. There's this concept that we need to have maybe two, three assistants around us for retraction and everything. So that's why I don't do photography. But the big dentist has three people around him. I am not able to do it.
Mhm.
So should I get into photography? What's your take on that?
Okay, so the perfect example for this particular answer would be me. I'm not a big dentist. I'm a very small dentist. I don't do a lot of cases in a day. And I have one chairside assistant. So if even if you have one chairside assistant, is completely fine. In fact, I don't use that chairside assistant to help me in dental photography most of the times, because when it comes to retraction, my patient has to be doing the retraction. Only if you think that the patient is not holding it correctly after trying it two times, I ask my assistant to actually help me out over there. um so that's one thing. It's a misconception that you need a lot of assistance. It's completely possible by yourself alone. It's just that you need to um mm, understand where you're going wrong. For example, there are many steps where you could be going wrong if you require an assistant. For example, as something as simple as focusing. A lot of people do autofocusing, and if you are doing autofocusing, trust me, you'll need an assistant, and that's where you're going wrong. So there could be many places where people who think that they need assistance might be going wrong. For example, a simple example of autofocus and manual focus. You need to do manual focusing if you want to do dental photography. You need to understand something called as the concept of magnification ratios, which I better not tell right now because it's a little too deep for beginners. But when you actually follow the step techniques or protocols, even in dental photography, things become simpler, and the number of hands that you require, it goes down. The problem is they want to go ahead and do dental photography directly without following the steps or the workflow, and that's where they think that they need assistance. That's not true. I would say there are 6 workflows for people to understand to be correct. And that workflow would be: number one is your camera setting correct, number two is your lens setting correct, that means are you on manual focus and your magnification ratio is correct, number three is your flash power correct, number four, are you using the right intraoral accessories, number five, are you standing at the right place for what particular shot that you want, and number six, is your imagination correct, in the sense, do you have a visualization of what you really want to take a picture of? Unfortunately, out of my experience, I realized that even the popular dentists out there, although they are taking great pictures, they are not really aware of what they should be having in a particular picture. For example, there is a very set guideline for each and every picture. For example, if you are taking an anterior aesthetic close-up shot, there is a very set guideline as to what you're supposed to see and at what angle it has to come. So a lot of dentists do put pictures on Facebook, but I think they are wrong. I mean, most of the times, in fact, because they are not actually following the compositional protocol. So when you get these 6 workflows correct, you don't require to have a lot of assistance because you have cleared the major work. And the best part about following this particular workflow is, out of the 6 workflows, at least 5 can be done before the patient comes to you. That means in advance. It can be corrected in advance, so you don't have to spend a lot of time in getting your workflow correct, because a lot of people think dental photography is time consuming, but it's not. I take around 15 seconds probably to take one picture.
I've seen that. Sometimes less than 15.
Yeah. Yeah, and that includes retraction.
Mm,
If retraction and all is done, I take probably 3 seconds to take a picture.
yeah.
That's how it's supposed to be done. It's very easy, very honestly. It's just that people are going wrong somewhere and they need to speak about it. They need to understand it, why they might be going wrong. And if they understand it, they'll not require a lot of hands.
You have been training a lot of dentists, from just freshly graduated interns to postgraduate students to the successful dentists. What is your advice for someone who's young right now and wants to be successful? In general, it could be related to photography, it can be just general. What you have seen the difference, basically.
In terms of dental photography, you're
And dental
asking?
photography and general. Anything in general.
Okay.
Because you have taught a lot of
Uh,
people, so the difference.
yeah, that's a tough one. For I can speak for dental photography. I would say that don't wait for yourself to become an intern. That's the biggest mistake that you might be doing. Start dental photography even if you are in first year BDS. That's the best time to start. People think that when patients will start, I'll start doing dental photography. Seriously, that's not true. Start doing it way before you come into your third year. And if you've already finished your internship, it's high time that you do a professional course. I'm not saying do it from me, do it from anywhere, but do a professional course, learn the pros and cons, learn the workflows, learn the techniques, learn what is supposed to be seen in a picture. Don't waste any more time, because you are going to enter into a private clinic or into your post graduation, and you need to be on target. Once you get into post graduation, it becomes a little bit like, okay, should I do dental photography now or not? But trust me, you're missing out on a lot of cases that you could have documented. And one more thing is that don't document only your good cases, you have to document your bad cases, although you might not show it to everyone. But those bad cases are going to be a lesson learned from your mistakes that you must have done in the past. Don't try and hide your mistakes, be open about it. That is one thing that I probably want to share with all the clinicians, because trust me, even the best dentists out there who are showing the best cases on Facebook or Instagram, I'm sure everybody must have done mistakes, that they're just showing their best. Behind the best, there are a lot of failures which they might not be talking about, but they have the documentation for it, and they keep it so that they go back to it and see that, okay, I had done this mistake, I probably don't want to do it. Nothing is possible without a mistake, and there's nothing to be scared of, failing. I don't think there's anything called failure. It's just either you are successful or you've learned something, and that's something that you need to understand as early in life as possible.
So when you told about photography courses, I remember I learned my dental photography course from you around 3 years ago. So if
Mhm.
someone wants to learn photography from you, where they can connect with you, where all do you take courses, and how do they reach you?
All right. So I do a lot of courses in different cities. These are my private courses. My private courses are typically 3 days long. So first day is about the basics of general photography and doing the entire clinical protocol on a typhoid. That's the preclinical work. Second day, when they come back, they have to appear for an exam and they have to pass with flying colors. When they actually pass that, is when I actually give them a clinical demonstration live on a patient, and after that, they are supposed to do a clinical photography on each other. That's the clinical documentation part. Every day morning, people have to submit what they had done the previous day. For example, if you finish day one, you have to come for day two, and you have to present nicely what you had done in day one. That's like a proper protocol wise. And on the third day, I've kept a chill day, like general photography, outdoor photography, because dental photography does get monotonous after a particular period of time. And general photography is what is going to keep your passion alive. So this is about my 3 day course, and I conduct this everywhere in India. But the major cities where I do it is Mumbai, Delhi, Bangalore, Chennai, Kochi, and Calicut, and Chandigarh, and a lot of cities about this. Even in Gujarat, although I've not been to Gujarat for quite some time, but almost in every state I've been doing these courses. So this is about my private course, and my own course, which is also a 3 day course, happens in Mumbai because I am from Mumbai, and that happens in my clinic. Uh, the biggest course in India, however, happens in Manipal College of Dental Sciences in their Manipal campus, and it's called the Integrated Dental Photography course. It's a long course in the sense it's a 3 month program, but it's a module based program. So it's a first module you have to attend a couple of days, and you have to learn all the basic stuff, and then you have to go back. You have home assignments, and you have to come back after 1.5 months, wherein you will have the second module. So the best part of this particular course is that it not only has theory exams, but it also has practical exams, which is not there in any of my private courses. And there's Viva was and spotting exams and a lot of other things, and studio light also in detail. In my private course, I do teach studio light, but it's more like a demonstration. But in the integrated dental photography course, the participants actually have to do it, and there's a whole lot of elaborate experience taking even in tabletop photography, which is also there in my private program. So these are the two courses which are offline courses wherein I actually go personally and teach. So I'm there basically in every city of India and even abroad. For example, I've done courses in Perth, Australia, and I'm also planning to do courses in Dubai, Kenya, and Singapore. So these are where I'll be doing my courses. For people who cannot come to me because of a lot of reasons, for example, the pandemic situation, a lot of people are scared. I also have an online course which I have not propagated enough right now. In fact, I've not yet told anybody that I have an online course. It is like a Netflix subscription or an Amazon video subscription, and you can probably watch all the videos and do whatever you want to do side by side as I teach it. And it's like a lifetime subscription that you get, so you can watch
Where
videos
is it?
at your convenience. It's on a website called as teachable.com. It's a great website, and it's also coming up on dentaledu.co. So these two website, my courses already there, but I haven't propagated them. And you can watch the online course, of course, at your own convenience. That's the plus point. And best part of the online course is everything is there and you can watch it at your convenience, yes, but there is something called as a monthly meeting wherein I do a live session with all the students, and then I ask them if they have any difficulty, and I sort it out, and this happens once in a month.
It was really nice talking to you. Thank you for giving
Awesome.
your time and joining us, sir. And
It
all the
was great. It
details
was great.
about all the podcasts and courses we'll be putting it on our Instagram page. Do not forget to go and check it out. Thank you once again,
That's
sir.
great. It was my
Thank,
pleasure. I mean, really enjoyed the session, and I hope that this particular talk might be helpful to the people who are watching it.
I'm sure they would be inspired. Thank you, sir.
All right. All right. Bye bye.